Welcome to another episode of MedMadness, where we break down complex medical topics into understandable and engaging content. Today we're diving into bulimia nervosa, a serious eating disorder that affects millions of people worldwide. We'll explore the key features, diagnosis and treatment options, and also touch on the risks and complications associated with this condition. By the end of this episode, you'll have a clear understanding of bulimia nervosa and the tools to help recognize and manage it. Next, let's discuss what bulimia nervosa actually is. Bulimia nervosa is characterized by recurrent episodes of binge eating followed by compensatory behaviors aimed at preventing weight gain. These behaviors can include self-induced vomiting, excessive exercise, fasting, or the misuse of laxatives and other medications. Unlike anorexia nervosa, patients with bulimia nervosa often have a normal weight or may even be overweight. The disorder typically presents in adolescents and young adults, particularly females, although it can affect anyone. The psychological toll of bulimia nervosa is immense, with sufferers often preoccupied with their body image and weight. This leads to a cycle of binge eating, where large amounts of food are consumed in a short period, followed by feelings of guilt, shame, and the subsequent compensatory behavior. Physically, bulimia nervosa can lead to significant complications. Self-induced vomiting, for example, can cause electrolyte imbalances like hyperkalemia, leading to muscle cramps, weakness, and potentially life-threatening arrhythmias. Chronic vomiting also leads to the erosion of dental enamel, parotid gland enlargement, and metabolic alkalosis. Consider the case of Sarah, a 19-year-old college student. Sarah was always concerned about her weight, especially after being teased in high school about her appearance. As she started college, the pressure to maintain a certain image intensified. She began binge eating late at night, consuming large amounts of food in secret. Overwhelmed by guilt and fear of gaining weight, Sarah started inducing vomiting and exercising excessively the next day. Despite her efforts, Sarah couldn't stop the cycle and her health began to deteriorate. She experienced frequent dizziness, muscle cramps, and noticed her teeth were becoming more sensitive. A visit to her doctor revealed severe hypokalemia and early signs of dental erosion, leading to a diagnosis of bulimia nervosa. In summary, bulimia nervosa is a complex and serious disorder that requires a comprehensive approach to treatment. Key management strategies include cognitive behavioral therapy, nutritional rehabilitation, and pharmacotherapy with SSRIs like fluoxetine. Recognizing the signs early and intervening with the right treatment can significantly improve outcomes for those affected. We encourage you to engage with the pre- and post-podcast quizzes we've provided to reinforce your understanding of this topic. Also, don't forget to review the Anki flashcards to help you retain the key points discussed today. Thanks for listening to Med Madness, and remember, understanding these conditions is the first step toward making a real difference in the lives of those who struggle with them.